Welcome to Nurse to Health, brought to you in conjunction with the Hofstra-Northwell School of Nursing and Physician Assistant Studies. I'm here with my co-hosts, Karim Nagdala. Dr. Nagdala, how are you today?
Not bad, Bob. How are you?
Doing very well.
And today we have a different sort of an episode. It's a special episode. We have two of our students, actually, Nick Serrano and Stephanie Chong.
That's
Steph,
me.
Nick, welcome.
Yeah, wow. Get ready to party, yeah.
Thank you for having us today.
You're welcome. We've been trying to do this for a while. You guys are just way too busy. You know?
Yeah. Blame it on Hofstra.
Well, we're gonna let you talk about what you've been busy with. But first, before we do anything else, you guys are both celebrating big events in your lives. So it's not all work, right?
No.
A little bit of play. So who wants to debut? Go ahead.
I recently just had my first child born.
Wow!
5.5 months ago.
Congratulations!
Yeah, my son. And that.
What's his name?
Samai. His name is Samai. That's Samai. It's a name indigenous to a language in Ecuador, Quechuan language, and just means inner spirit. Means a couple things, like inner spirit, to breathe.
I thought it meant future nurse anesthetist.
Maybe we'll see. He's so far 5.5 weeks. He seems like a smart kid already. So We'll see. But first child. And that has been a challenge of itself. Though school was hard, but parenting, is going to be, I see, a challenge. We're doing it. So
You're doing it. And by the way, just so both Karim and I are parents, and John as well. I mean, this isn't even advice. It's just a heads up. As hard as training is now, you actually get a degree and you're certified. That just never happens with parenting. I mean, it's constantly, figuring it all out.
Yeah.
Right?
I mean, like we spoke earlier, it's like as you're trying to do things for the child, it's like, are you doing the right thing? Is this how it should be done? And, we mentioned there's really no right way to do things. So it's kind of just like trial and error, seeing what works and what doesn't. And, each parent is different, each kid is different. So it's like, we're testing out, trying to see what works. But, right now it's mainly just like he wants to be fed, he needs his diaper changed, and he wants to take a nap. So we're in a kind of like, okay, we can narrow it down to these three things. But as the weeks are coming in, he's starting to get a little more curious into other things. And I'm like, okay, what's going to happen when he wants to investigate things? He starts crawling around the house, and we got to teach him boundaries. And that's where, more of the parenting style is going to come into play. So
I know you well enough to know, you're conscientious, and I'm sure you'll do great. It's like I told you before we got in here. So, my wife, Cecilia, and I, we have 3 kids, and we sort of joked a few years back about the 3rd kid, but it wasn't really a joke. I told my wife, I said, listen, we got one more chance to get it right. And it was like, ha ha ha, but it's like, no, I'm being serious.
Yeah.
My kids are great, so, because they'll probably listen at some point. So, Stephanie,
Wait,
what about
pause. I do want to comment. Your kids are phenomenal. Don't forget, so Dr. Gluck does this thing where he volunteers every Friday at a senior living center, and he plays the piano and music for the senior citizens. And we had the opportunity to go with Dr. Gluck, and I can tell you his 2 kids who are over 21 years old are sitting there on a Friday surrounded by old people singing and dancing with them. So I think you did a superb job raising them. You really
thank
did.
You. I appreciate that. And kudos to my wife. And by the way, at some point we'll have to record out there. A bunch of us live out there in Suffolk, and it's in the East Northport. And we're out there just about every Friday afternoon at the Assisted Living Center. And I think that'd be a great episode. So we'll make that happen. All right, Stephanie.
So I'm not as fun as Nick. I didn't become daddy. Nick became a daddy. I became a Mrs. And I said, F yeah.
Wow. Congratulations.
Thank you.
Oh my God.
I felt like a princess all weekend, and I actually just re-proposed back to my boyfriend last night. And he also said yes. And I'm like, good thing. It's yes or death at this point.
You need to mention his name. He's going to be.
His name is Stanley. So we don't have Samaya. Sorry, we have Stanphany. It's just a combination of our names together. But yeah.
That's awesome. Congrats.
Thank you. It was perfect. I still feel like a little princess. And I think this goes to show that even though school takes up all of our life very much still goes on outside of the world. And even though we weren't ready, life is always ready for us. So we just have to take the second and just embrace life, even though school is.
But you're Stephanie. Come on, you're always embracing life. I mean, nobody could see you. This is not a visual thing here, but you're sitting here with, what is that, purple hair?
It's
I'm
blue.
colorblind. Is that blue? I mean, I have no hair. I don't have to worry about this sort of stuff. So Kareem, I'm going to turn it over to you because you're closer to what's going on with them than I am because you graduated this program.
Yeah.
And let me let you sort of start things
I
up.
think it's interesting because, as you guys know, I was in the program as well, and I was doing a lot of the same things that you guys were doing. I had kids in the program, married in the program, just a ton of stuff. So what's that like for you guys? Because for me, when I was doing the regular master's acute care program, I would say it was part-time. For you guys, it's full-time, right? Because you're doing what? You're doing acute care, and you're also doing CRNA.
Right.
And just for our audience, CRNA is?
Certified Registered Nurse Anesthetist.
Which in plain English translates into, what do you guys?
Basically, we have the capabilities of what anesthesiologists can do in a sense where we are going to be administering anesthesia. We're going to be doing a preoperative, checklist going over the patient's medical history, ensuring that they're fit for surgery, inducing the patient for the procedure, sedating them, sometimes paralytics, and then re-waking them up when the
That's it. The waking up part is important.
Yes, very important. Yeah, the second half is key.
Yep. Calling cardiology for clearance. I know how it is. Yeah.
And pain management, right?
Yes.
Big pain management. Yes.
Big deal. Right?
So how is that balance, like that sort of school life balance with being full-time in school, doing all this amazing stuff? How is that?
So I think before we started school, a lot of us had to have very in-depth conversations with those around us because, we're going to school, but essentially everyone around us is going to school also. I mean, I know Dean McLeod said divorce this, divorce that, but you can't do it alone. So it was hard. I personally couldn't really balance initially. So I was luckily in Dr. Gluck's class and I was in Pearl's with Nick. I think they both have shared moments and have seen me really down and really sad. I was honestly very depressed. It was very difficult to balance everything. I think we all have expectations on how difficult it'll be, but unless you're actually in it, you don't really know the pressure of everything. And it's not like you're competing against other people, you're competing against yourself. You go through like this identity crisis where you were so confident and so intelligent in your level of skills for nursing, and you basically have to restart new, and it really humbles you as a person, but more importantly, it was difficult to unlearn everything that we've known and learn everything again without feeling, reduced to nothing. But we had such great support.
So let's just dig down to that because it's really important for anybody listening who might be considering this as a career and just, in general in life, philosophy of life. There's a huge demand on you in terms of what's expected, in terms of the outcome, because you have people's lives literally in your hands, right? I mean, it's not too much to say that. Not only is the expectation in terms of where you're going to be when you're done, it's really high, but it's a totally, and you sort of alluded at this, but I want to dig down, it's a total paradigm shift, right?
Yes.
So as a nurse, I'll let you explain it. Your focus is sort of you're on the receiving end of directives, let's
Correct.
say. Go ahead and drill down into that a little bit.
So I do want to say in New York where we're practicing, CRNAs are not recognized as advanced practice registered nurses. So we don't have like a own scope of practice in a sense. So in New York, we're supposed to provide under the medical supervision or direction of a physician. As a nurse, we've been a nurse for, I want to say like at least 8 to 10 years for both of us.
Years, yeah.
We always had orders, right? As rebellious as I am, I'm very good at following orders. So when I was initially in clinical, and of course we were under the wings of our preceptor, it was still very nerve-wracking to think that, like a bartender, it's like whatever I give out in this alcohol proportion is what my patient is receiving, and how it affects them is very different. Everyone metabolizes it differently. Everyone is a different age. Everyone has different organ status. You just don't know how it's going to be. And it's to think that whatever I inject on my will is going to cause a certain experience for the patient. And this can either be a really good experience for them, or it can give them PTSD, because sometimes patients wake up and they're scared, and this is a very real thing. At the end of the day, it's all about safe, but sometimes it's difficult because it's like a little factory sometimes, you got to push out a certain amount of product with a limited time that you have a certain amount of time to just really bond with your patient and make sure they trust you. It's a lot to handle. It's difficult, and I have to say, thank goodness we've had ICU experience for a certain amount of years before embarking on this journey. And even after all those years, it was still a very, very big learning curve for us.
Yeah, I'll just sort of digress for a second, but not really, and then I'll turn it over to Nick. You could comment on this as well. This is orientation week, and yesterday part of the discussion was some of the students felt that they were being too pressured or whatever. And there was a bit of a discussion there about, well, yeah, all right, hey, listen, there are certain microaggressions and pressures, not because anybody's trying to be mean, because of necessity, when you hit the quote-unquote real world,
right.
Guess what? Those pressures are there of, just contextually, right? I mean, not that anybody there's no vendetta or anything like that. So, Nick, what do you?
Yeah, well, I mean, when you say you hit the real world, it's like you see it in clinicals, right? We do scenarios, we do simulations where we're sitting there, we're taking care of fake patients, fake mannequins, actors, things like that. But when you're sitting there in clinicals and you're actually in the hospital taking care of real patients, that has real outcomes, what you're doing. And, you have to be sure of your capabilities and your knowledge, and you really have to be dedicated to this program. This isn't something that you can kind of, be half in, half out and say, I kind of want to do it, I kind of don't want to do it. Like once you're in, you're in, and you have to swim, you have to be dedicated and disciplined to do it in order to be able to ensure that your patients are going to come out safe. I mean, you're essentially giving them medication that's going to, halt a lot of their normal, physiologic functions.
Yeah, I mean, just to let people out there who are not familiar with this stuff, I mean, so everybody knows about what happened to Michael Jackson, or most people do, right? So that was one of the drugs, propofol.
It's a hell of a drug.
Which is a hell of a drug. A hell of a drug when used correctly.
Correct.
But a little knowledge is a dangerous thing. So, I think it was a cardiologist who was way beyond his scope. From what I know, he was a smart guy, but
doing what he shouldn't have been
doing. What he shouldn't have been doing. And, we have a dead Michael Jackson.
Right. So that's the thing. It's like, you don't want to kind of just be guessing when you're doing this. You really want to know what you're doing. This isn't something to play around with, where you're potentially giving medication that's going to stop somebody's, breathing, that's going to, paralyze somebody, it's going to sedate somebody, it's going to, potentially have some neurological effects on them. So you got to make sure you have your dosages down, and to, kind of take these things lightly is where you can kind of fall into a bad outcome,
This is a good segue, I think, Kareem, into the world of pearls, right? I mean, this is sort of pretty much the message, that you're trying to convey, right?
So
during orientation.
Yeah, I mean, we just had orientation today, and we were talking about pearls and what's the motivation behind it, right? And so we compared it to like the aviation industry, like a pilot, like, hey, how do I keep my passengers safe? How can I train this pilot to know what they're supposed to do before they even get in the cockpit?
To remind our audience, Pearls is
like a self-directed learning modality.
Right.
Where you guys will not necessarily tell us what to know. It's more of like, here is content. You have to figure out what's important and what to know and how deep to know about it.
Yes. Pearls is patient-centered explorations, active reasoning, and learning synthesis, right? And it's, as you astutely described it, it's just a methodology. We use cases. We use different problems to stress you guys a little bit, to get the brain working, to try to figure out what's going on with this patient. But I wanted to actually go into a point that Steph made about the fact that CRNA is not independent. I find that kind of shocking, to be honest with you, just knowing the rigor of the coursework that you guys have been doing. I think that was one of the motivations. I know, like speaking with Dr. Petrillo about the CRNA program, why was it even necessary to add in the nurse practitioner portion or the DNP portion, right, the doctorate? What are your guys' takes on that? Like, do you think that we're at a point now, knowing what we know about the curriculum the rigor that you guys have been put to, and the fact that you guys are actually not only CRNAs, but also nurse practitioners and also have a doctorate on top of it? What do you think?
I think we're all interested to see how Northwell, when we come out, will use us in both roles because, again, we're only doing this because we're in New York City State, where we're not recognized with a scope of practice, even though I actually went to Albany to protest as well with the CRNAs, and it was quite interesting. Regardless of the fact, they did both programs for us to essentially have more independence because nurse practitioners are recognized in New York State. So we're trying to see if this is a way for them to combine both degrees for us to be a stronger practitioner to administer care. We don't know how it's going to align in our roles in the future, right? Sure. Because there are already working CRNAs and there's already working NPs. Are you going to create a role specific to just us, or are you going to pull us in different ways to help make the system work or run a little bit better? So we're not quite too sure about it.
I think specifically, too, it came about after COVID. There was a big need for independent practitioners in the short-staffed ICUs and the care areas where they had critically ill patients and not enough providers. So they were pulling people, providers from different areas, and CRNAs had been pulled to, provide care and be almost autonomous in these care settings. And they said, well, if it's okay during an emergency, we showed that, we provided sufficient quality care. We can do this out of an emergency and help unburden the healthcare system and the shortages that are currently, that we're dealing with. So
correct. And we see this in the VA also, where CRNAs are the primary anesthesia caregivers and on the fields, and they can be on a helicopter and they are, in charge of a certain mileage above. But how come when they come back to their own city, they suddenly have their independence revoked from them? Exactly. It's almost disrespectful to the schooling and the experience that they've had, especially on the battlefield, where you have minimal to nothing. In a hospital, you have monitors, you have machines, you have technology, you have medicine. But on the field, they have literally nothing, and they're still able to give care. But the moment they come back, they're like, oh, no. You're limited in what you can and cannot do.
So, we're going to have the governor on next week and people from the state. No.
Well, it's funny because Dr. Gluck, when I went to protest in Albany and I'm talking to these congressmen, they're like, so what is the difference between you and an anesthesiologist? I'm sorry. Did you not hear us the first time? This is like the multiple time we're coming here petitioning, telling you our story. Right. And it seems like they don't even to their level understand what the fight is truly about. And at the end of the day, we're not taking...
I don't know if it's that they don't understand. There's a lot of campaign finance that goes into this.
Correct.
And, the AMA is putting out a lot of money.
You think money's involved?
It's 100% money.
That's unusual, right?
Wow. And who are the richest? It's the anesthesia doctors.
Because we know that it's not the schooling. I mean, the schooling is very rigorous, right? I mean, you guys are... the stuff you guys are doing is amazing.
I paid them the highest compliment. I don't know if you remember me saying this. I just, when we got done, and I'll say it again, I'd have no issue with them taking care of me or anybody in my family.
Well,
it's a pretty good compliment,
absolutely.
Right?
Yeah.
Appreciate that.
Thank you.
It means a lot.
Do it for free.
So, let's pull back a little bit. So what motivated you to get into healthcare, just in general, and then specifically nursing? And then what motivated you to venture into the unknown of and the rigor of the program you're in now?
So how did I get into healthcare? So basically, after I had come out of high school, I was kind of, at a crossroads like everybody else is at that point in their lives. And you got to make a decision, right? It's like you go to school, you get a degree, you learn a trade, or you end up doing nothing, And the last option was not an option for me. My father wasn't going to let that happen. So I opted to go to college, and I had always been good in the sciences. I was always really good in health and sciences. So then I went to a counselor, and I spoke to her, and I said, I want to do something where I can help people and kind of apply the things that I'm already good at. And so after we looked over my transcript, she had suggested nursing. She was like, nursing's a great career, especially for men. They were looking for more men. And, it's great pay. And she kind of laid out the timeline that it would be. And I said, sure, why not? I'll go for it. And as I took the classes, love learning about the human body. I love physical fitness education. Like that's always been a big part of my life too. So the more and more I did it, I was just eating the stuff up. I was like, this is great. And then I went to Stony Brook for nursing, and the rest was history from there. I worked at Stony Brook for about 5 years, and then in the surgical ICU, the CT ICU, I was in PACU for a little bit there also, and then I did travel nursing for another 5 years, and I worked in New York, California, Maryland. I've worked in Brooklyn before, in and out during COVID and all around.
I'll let you continue, but let me pause you for a second. So you mentioned, they needed more nurses. You guys out there listening can't see Nick, but he's sort of like, he's a macho guy. He's like, looks like The Rock, Dwayne Johnson or something. So
did
you? No, really. So Did you ever have any issues with the old stereotypes? The
male and nursing.
Yeah, male and nurse gender whole
all the time. Yeah, I mean, you hear it all the time. Especially that was around the time that movie Meet the Fockers.
Yeah. Meet the parents.
And it was a lot of jabs here and there from a lot of my friends because a lot of them didn't go into this career. They didn't even know like that guys would get into being nurses. But I was okay. I got thick skin. You know what I mean? So it's fine, the stereotypes, but to break the mold with that, you have to show that you're competent and that you're capable. And a lot of times, like, people would worry that, the male nurse, he's kind of like a meathead. He doesn't know what he's doing. Well, if you get up there and you kind of, vocalize or verbalize like what it is that you're doing and what you're going to do for a patient, they kind of feel really comfortable. And I've had some patients give me some really good compliments in the past. And it's funny because my wife's a nurse also, and she used to get jealous because these patients would give me gifts, and I'd come home with these gifts, and she's like, "What are you doing? What are you doing for them?" I'm like, this is what they're giving me.
Because you're a nice, compassionate guy, which is, a lot of that stereotype came from I guess, quote unquote, good place in the sense that, with gender stereotypes of, females being more nurturing and all this sort of stuff. But but you're a nurturing guy, right?
Well, the thing is too is like before when I was maybe 17, 18, up until like 21. Well, actually, I did it into my 20s too. I did a lot of Brazilian Jiu-Jitsu and MMA, UFC kind of training and stuff like that. So we used to compete. And when you do that, you kind of learn to just be very like tranquil and calm and collected. And you grow thick skin, but at the same time, you're not easily upset. So I can attribute a lot of that to just helping me deal with anything.
Yeah, it's interesting. Just as an aside, so I don't know if we ever talked about this. One of my close cousins, I'll do a shout out to David Meyer out on the West Coast. He's a multi-time world champion Brazilian jiu-jitsu guy. He's one of the original, I think they call him Dirty Dozen guys. We got the first Americans to have black belts in this country. He's actually going to be coming to visit in a couple of weeks. And same idea. He could kill you with his bare hands kind of thing. But he's the most tranquil guy. He's into animal rights and all sorts of really good stuff.
Well, my father-in-law, he's the one who got me into it, and he's very short. He's like 5'6". He's a very, very short guy, and he is a lethal weapon. He's like worked for NYPD. He does like details for different government officials and things like that. But he's the most calm guy. Nothing gets him
because you have nothing to prove at that point, right?
Exactly.
Yeah. How about you, Stephanie? I will come back to you, Nick, to let you continue. So how did you get into healthcare?
Well, pause. I don't want to sound like a hater, but although you might have experienced quote unquote stigmatism towards you because you're men in nursing, is not half the CRNA population men? How are you such a small percentage of the nursing workforce, you males, but you end up being the highest you make the most money? Half of it is you guys.
That is very true. Yeah, there is a little bit of a discrepancy as we get into the
Are you stirring things up here?
A little bit. For sure. I'd be instigating
if
sometimes.
You don't know Steph, that's the
but I started nursing, and I always felt like it was the luckiest thing of my life that I kind of knew what I wanted to do in a career. I figured out when I was 16, my mom, she might have had breast cancer at the time, and I'll never forget how scared she was. So a little backstory, we're first generation immigrant here. Growing up, I had to take the responsibility of doing like the paperwork for my parents. I was the only one that spoke English. So when we were navigating the healthcare system for my mom to figure out if this was cancer or not, I realized that I could have made a difference here because I made a difference for her. I was very lucky. When we grew up, we were Buddhists. We did this thing where even though we didn't have much, we always gave back. So either it's buying porridge for a homeless person in Chinatown while I'm going to liberate like sea animals or whatever. I realized that I really like helping people, and I love old people. Like if you're 85 and older and on this radio station, you're for me. But I just realized it, and then I went to Hunter for undergrad. I was really lucky. I got in. It's been there since. I used to work in a Chinatown cardiology clinic in Chinatown since I was 17. We had a very high volume of 100 to 200 patients per day. So at a young age, I had to work to help support my family, but I also just realized how much I loved working in that facility. I felt like I was giving back to my community. I felt like I was increasing like my Chinese cultural skills and speaking skills, and I felt like I was able to help them even if I didn't truly make a difference in their care. I was able to help them in some sort of way during that visit, and that became, very prominent to me as I became a nurse. As I was graduating, my uncle actually went into liver failure, and he was in Bellevue, right next to Hunter. And I had to become his healthcare proxy because all of our family was away in Malaysia. And it was during that time that I fell in love with nursing even more, because the nurses that were on the other side taking care of me and my uncle acknowledged me as a nursing student, but most importantly acknowledged him as a person, even though they didn't know who he was. And we were lucky to get him into hospice, and that's also a big reason why I love palliative care to this day. So I actually am planning to pursue my NP degree and get palliatives in Columbia at some point, just so I can close that circle up for me. But I've loved nursing always.
Very nice. So life was good as a nurse. Why the change? Why come back to student life?
I was a workaholic. I had 3 jobs all the time, and 3 jobs was barely...
Only 3?
Only 3. I know. I almost had a 4th. I had to give it up. But I used to do pre-post and sedation. I used to work in a hospital. I worked at Columbia University, and I did medical sales also. I had to work these 3 jobs just to support barely enough for me and my parents. I had a mortgage to pay. I had to mortgage their place. It comes with being like a first-gen immigrant family. Like, you don't get to just start your life. I'm sorry, I don't have like a trust fund waiting for me. Right. You know, there's a certain expectation.
You have Stanley, right?
I have Stanley, yes I do, but I feel like my child would have this American life that we've all dreamed of. It's me and this generation that has to make the first step. But a lot of it is for my parents. Like, my mom came here when she was 21, had nothing, and she has me, and she hasn't worked a day in her life since I became a nurse, but it's not even enough. Like, she gave up her life in another country and was with my dad here, and was completely like just new to this place, and to this day she still misses home. Like, what can I do to give her a better life and experience that she gave up for me? And this is such a real thing that all of us face.
You know, it's funny you said that, because it's very similar to my father's story. Like, he came from Ecuador when he was 11, and he weighed like 90 pounds. He said he was like skin and bones, and, you know, he struggled to provide so much for us. And when I started working, when I was like, 14, 15, and I started getting jobs, and I told him, I was like, oh, I want to give you my first paycheck. And I told him, I was like, I'm going to work, to try to really pay off the mortgage on the house and things like that. And he told me, he's like, the best thing you can do for me is make me not have to worry about you. He's like, if you can go and take care of your business, become financially independent, then that's the best thing you can do for me.
These are great American success stories, right? I mean, Kareem, we were talking today about your background from Sudan and Egypt, another immigrant story, right?
Yeah, so my dad grew up in Egypt. My grandfather's from Sudan, grandmother's from Egypt, and on my mom's side from Haiti. And both my parents are first generation. They came here with basically nothing. And you have to work your way up. And I definitely share that sentiment, Steph, about, not having the trust fund, because you basically have to work multiple jobs to make it, Yeah,
just to barely sustain. I
do think that, when I think of, like, for myself, I went into nursing initially. My sister actually had passed away from, she had stage 4 colon cancer. I just remember the nurses that took care of her. I was actually in school for something completely different. Before I did this, by the way, like, I did tons of things. I did graphic design. I worked security. I did things that were like you would never even think. I was doing construction with my dad. Like, I wasn't even in healthcare at all, but it was that moment of seeing my sister and like just seeing how she was sick. And I was like, I don't know what the heck is going on with her. It just didn't make any sense to me. So I said, you know what? I don't like that feeling, and I wanted to do something different. And that's how I got into nursing. Hearing all these stories, some people think, well, the motivation, why do they want to be CRNA? They want to make $300,000 a year. It's like, actually, there's a deeper motivation there,
We want time back.
Yeah, and I think it's amazing, the stories that you guys just shared.
Yeah, I mean, if you're doing anything in life, I mean, nobody likes to generalize, right? But if you're doing just about anything in life for the wrong reasons, namely, the paycheck, at some point it's not going to work out that well. Certainly not in the healthcare.
No,
not going to be.
This isn't a job you just get into for the money, because I'm telling you right now, it's demanding, and you have to be committed to the schooling of it. When you come out and you actually are doing the work, it's fulfilling. It is fulfilling. When we get our patients ready for surgery, we get them nice and comfortable for the procedure, wake them back up. it's fulfilling when you do all that correctly, but if it goes awry, it can be very hard, and you can be hard on yourself. But that's why you can't take this lightly. This isn't just a job. You're just like, oh, I'll just go try it out. We'll see how it works out. Like, you really got to be committed to it.
Right. I mean, and work limitations have come into play for good reasons and stuff. But everybody says back in the day when I trained as a surgeon, we didn't have those, and it didn't matter if you were working 40-hour shifts if you had that sense of pride and responsibility, and if your patient wasn't doing well, even if you hadn't slept in 40 hours, you made it your business to go back. So it's not quite that way, but in some sense it is.
Yeah,
right?
No, it is very fulfilling. Right?
Yeah,
I mean,
and just like nursing, like there's a huge art and science to anesthesia too, right? Like there's all the science of understanding the mechanism of action, how things interact, what the onset, all the timing, and then there's also the art, like how are you going to do it? How are you going to give the medications? What experience are you going to give them? I remember talking to Nick's wife. She did clinical in San Diego, and she was working with an anesthesia attending that made it a psychedelic trip for the patients because that's what they wanted.
Santa Monica.
Yes.
This guy in Santa Monica, shout out to Wei. He's amazing.
Oh, this sounds good. Right? Don't edit this out, John.
Yeah. But he's amazing. He actually, he does like this whole non-narcotic, non-opioid anesthesia, and he kind of puts people in a nice, place with, he gets like a starlight machine, projects starlights in the OR room. He dims the lights. He gets these like gong bowls when he's like giving them like a little bit of ketamine, a little this and that.
This is where California.
Yeah, California. It's amazing. But
psychedelics and ketamine and all that's a big deal now, right?
Yeah.
Yes, they're coming.
A lot of work is being done with them, and research is showing that they have benefits with depression, PTSD.
Mm-hmm.
A lot of ketamine clinics are popping up here and there. It's good stuff.
I used to do nursing for a ketamine clinic, and it's just amazing. Like you give them a little ketamine, and it's also like a huge therapy session with the psychologist in the room, and you hear the way that they break down like their layers of problems and how they perceive things, and then you walk them out and they feel truly a lot better. And the FDA just approved for ketamine to be intranasal for suicide ideation. There's a huge need for it now with all this mental health issues going on with America.
Yeah. Right.
And now a lot of people microdosing on shrooms. Now there's a lot of research to that too, to see how that affects mood and regulation. So it's definitely something that we can look into as a healthcare industry.
Because to kind of bring it full circle with anesthesia, there's no one way to do anesthesia, just like there's no one way to do parenting. In a sense, right? There's different styles and different methods, and but that's why you have to be committed to the profession and kind of really study hard and do your own research as well, because you want to be able to provide good outcomes for the people that we're taking care of.
Yeah, for sure. So Nick, I think we left you hanging on in terms of where your decision to come back to student life. Yeah.
Oh, I ask myself that every day. I'm like, why did I decide to come back? But all
right, I withdraw that question. Go ahead.
I came down to, I had been a nurse for 10 years, and I had done it on both sides of the U.S. between New York and Cali, and I was like, what's next? I could, live comfortably and do this for, foreseeable future until I retire. Or I can, take an opportunity now and try to further my career and kind of myself in this field. So it came down to a big conversation I had with my wife. I actually went to California to travel nurse because she was in CRNA school. And I told her, you do that first because, one, she's smarter than me, hands down smarter than me. So I was like, you
just scored.
You sound like you've been married a long time.
A long time. We're going on like 17 years now. But
I was lucky you said that. This would have been your first and last kid.
But so I told her, I said, you go, you'll get it done, and then I'll decide and see if I want to do it later. I was still kind of on the fence. And then once I hit that 10-year mark, I said, I'm always somebody who does not want to live with regrets. And I don't want to say to myself 10, 15 years down the line, what would happen if I did try? Where would I be? Would I have liked it? Would I have been a good provider? Could I have done it? And I said, now's the time. I said, we didn't have kids when I applied. So I said, let's just go for it, And my dad's always been one that, if there's an opportunity that presents itself, go for it. So when I found out about Hofstra's program, it was close. It was local. We didn't have to move. I could just commute. And I said, this might be a good opportunity. And I went for it, and very glad that they accepted me. Yeah.
Yeah, that's all fantastic, man. I mean, how was it during the program itself? I mean, you guys were my students in Pearls. How was that?
So Pearls is an experience in and of itself.
Now hindsight being 2020, you guys are now seasoned, right?
Yeah.
So now how was that?
Go ahead.
Yeah, let's
lay it on us.
I don't mean to toot Hofstra's horn, but the information that I learned from Pearls, the information that I learned from Pearls is like the only thing I still remember to this day. Everything else I have to restudy, re-look over.
Kareem, you gotta take that out.
Yes.
Ourselves on the back.
Shout out to Nagella and Dr. Gluck. Obviously, me and Nick, we also had special Pearls because it was Pearls with Dr. Gluck. Mm-hmm. And we had a lot of fun learning. Like, we found new ways of distributing information and learning from each other. And it's so interesting because you grow up, you've already been through X, Y, Z amount of years of school, and you're like, what is the actual way I learn better? What is the way that I learn most efficiently? And in Pearls, we got to really explore that, right? We had reading, we made games, we did Jeopardy, we did classical chairs with games. We did all this type of stuff to make you use your brain, and the way that we had to wire our brains to remembering the information and speaking to it and discussing it in person without any notes, it worked because I still remember it to this day. Like, I can probably still tell you DKA to this day, and I remember it because we drew it on the board.
I mean, look, I think I said it before, but it's worth repeating. I mean, this is music to Kareem's ears.
I'm grinning from ear to ear.
This is basically the message he's trying to get through to, during orientation. Yeah. And look, I appreciate the compliment, but, and I don't want to be falsely humble, but it's important to say it really is. There's the expression, it takes a village. It really takes a collaborative effort. You guys were great. I mean, I helped facilitate those interactions, but you guys made it happen. It was a great group, and you guys put in the effort. Pearls does not happen without the buy-in and the participation and the preparation of the group. Okay, no matter who the facilitator is. I mean, Kareem, I think you're nodding your head. Yeah.
Yeah, no, I totally agree with you. It's something that is a culture shock, right? I mean, you guys remember, I just had a group of students right now, and, they're all sitting in the room, and they had the same look on their face. Yeah. Just like, oh my God, what did I get into? But, you guys are living proof that it works.
Listen, to all the students out there listening, okay, it is frustrating initially. You don't really understand because it's something that you've never done before. Mm-hmm. Like, I've never done anything like Pearls. Steph, have you ever done anything like Pearls before?
No, I used to roll my eyes every time you guys said spiral pedagogy. I'm like, what does pedagogy even mean? And then it spiraled. Yeah. And then it clicked. And then you're like, it works.
Yeah.
It's all like Kareem's been repeating the mantra, trust the process. I really think it's important to underscore, beyond the substantive knowledge that's gained during Pearls, it really is, people talk about it being a microcosm for life. And in healthcare, you cannot function independently successfully. I mean, you need to collaborate. We just had this discussion earlier today, right over at the med school. It takes a team of people who are dedicated and involved and prepared, and Pearls is really that microcosm in terms of that process.
I want to ask you guys, because it's interesting to me, when you first went into your clinical years, right? So like you did the white coat ceremony, you're going to start going into your clinical rotation. Did you feel you were prepared?
Never.
Let me rephrase. Not if you were prepared, because obviously there's going to be some anxiety. It's a new situation. Right. But in terms of the content that was delivered to you, did you feel that set you up in the right track?
The content that's given is what we're going to need, right? But when you apply it in a clinical setting, that's where it's like very like, oh, this is real. This is it right now, And
The anxiety level.
The anxiety level's there. And then also, I mean, the way, for example, like the sim labs we'll have set up here, it isn't necessarily like that at every single site that we go to. So if something's a little bit out of place, it's not like I've done it a million times, right? So if they have their blood pressure cuffs in a different area, now I'm all thrown off. Now it's like, oh God, I'm trying to figure everything out, you know? So it did help for sure, but honestly, it's nothing like when you're actually in the site.
Which I guess to go back to Karim, to your analogy in terms of background for Pearls and Sim, talking about the aviation industry. I mean, I'm not a pilot, but I imagine you're learning to fly on a Cessna, and then, somebody puts you in the cockpit of a 747 or something, right?
Yep.
It's going to be a culture shock.
Yeah,
or whatever.
right. And setting up for different surgeries and things like that. So it's like, but the thing is, I think one thing you guys do here, which is really good, is you guys really emphasize focusing on like OSCEs and the sims, and that is extremely important. I think that's where more people need to go. Actually, our DNP project is about simulation-based training. Yeah, I don't want to say the topic, but simulation-based training, and just how it enhances learning and how it actually helps with retention years later down the line as compared to people who don't receive that. So
when I speak to students who are applying to CRNA school, one of the things that I do say about Hofstra is you guys are very well resourced. You guys have the tools to help us learn and succeed. You guys have Cadaver Lab, where Dr. Gluck literally skinned off the man for us. Yeah. We have simulation labs. We have OSCEs, like you said. We have standardized patients. I came from Hunter CUNY. We didn't have these resources. And I can tell you that it makes a difference in the learning. There was so many times that I did a sim, and it was something as silly as like an infiltrated IV, which you would have thought I would have known as a nurse, but it happened in real life under the OR in a robot case. My IV infiltrated. Nothing was going through. And I'm like, thank God I had this sim, because would I have looked? I might have looked much later, but the sim is something that you feel in the moment, and it makes such a difference in your learning and with your learning, with your knowledge retention also. So Hofstra does a great job with that. Like, you guys have very good staff and very good resources for us.
Yeah, you can sit and take a test 1,000 times, right? But when you're actually in the OR and you're dealing with patients, I mean, you need to have that kind of muscle memory where it's like, okay, his patient, the hemodynamics are off, something's going on, because that's not necessarily just going to be an A, B, C, D, question. So.
Well, she had an experience where something that was in a sim actually translated into real life, right? Do you have something like that?
So we actually had a sim where during induction, the patient's hemodynamics kind of like went to crap. They crapped out basically. Patient's blood pressure dropped, and they were just trying to see how I would navigate that. And in doing that, when I first got into clinicals, it was during my first semester, that happened, and I was quickly able to say, okay, we need pressors, we need to do this, we need to do that, as opposed to just kind of sitting there and just being like, trying to think of what I read in a textbook or something like that. It's that actual hands-on muscle memory doing it. It's important because when you get into the field, like, that's what you have. You don't have the ABCDs.
Yeah.
So
we could easily go on for another half hour. So I think, right, you guys are having fun. Huh? This is the anxiety is gone stuff, right? See? But unfortunately, we're going to have to wind down. But before we go, any words? I mean, I'd love to hear more stories. I mean, I love the war stories. We can make that happen. But just before we go, any parting words of wisdom, advice to anybody thinking of? Yeah, go ahead.
So my mom told me as a girl and as a woman, she said, the only thing a man can never take from you is your education. So if you're thinking about going back to school, if you're thinking about making yourself better, if you're thinking about advancing yourself, do it, because that is knowledge and education that no one else on this world can take from you. And even if you lose your money, you lose your status, you lose your house, you have the education, you can build it all up back again.
That's beautiful.
Yeah.
Love it.
For anybody thinking they want to go into school, I would definitely say just make sure you have good support systems, and just make sure that you have gauged yourself as far as what you do when you're stressed out. It's a big part of school. You will be stressed. You will have times of frustration, and you have to have good coping mechanisms. You have to find out what works for you. For me personally, it's been physical fitness, like working out. Like, that's something I had to maintain consistently. And the times that I got rid of it because I thought I was like, I got to do more studying and cram more and do all this, I did worse. So you find out what works for you and try to maintain that through the program, so that way you can succeed.
All right. Hey, listen, this has been great. Yeah, we'll definitely have to have you guys back. You guys are too much fun. but all your other colleagues are going to be jealous. We'll have to make time for them too. But we'll figure it out. So just, again, a big congratulations to Stephanie Chong on her engagement.
It's also my birthday.
To Stanley.
Oh, happy birthday. Wow.
I'm 30 today.
And happy birthday. She's 23, I think. And to Nick Serrano, and congratulations to you, Nick.
Thank you.
For the birth of your son. And on behalf of my wonderful partner, Dr. Kareem Nagdala, and myself, and on behalf of John Mullen, our first-rate engineer, we could not do this without him. This has been another wonderful episode of Nurse to Health, brought to you in conjunction with the Hofstra-Northwell School of Nursing and PA Studies, podcast that brings you the past, present, and future of healthcare. Bring you to the front lines and behind the scenes. Stay well.